L4, L5 disc bulge exercises are not working. If you're doing exercises to help heal or correct an L4, L5 disc bulge or an L5S1 disc bulge, and you're wondering why these disc bulge exercises are not working out for you, there could be some reasons why, which I'll explain in this video. And not only will I explain the reasons why they may not be working for you, I'll also give you some suggestions what you can do to make that better. So in this video, I'm going to go over 3 possible reasons why exercises for L4, L5 disc bulge or exercises for L5S1 disc bulge may not be working out. Hi, I'm Dr. Walter Salubra. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. Welcome to my channel. What this channel is about is giving you tips and strategies on how to strengthen and stabilize your spine and your back. Like this, you can bend, move, and lift normally and without pain and limitation. And of course, what that means for you is living a normal life, doing the things that you want to do. So if you want these tips and strategies, do subscribe right now by clicking on that red button below, tap on the notification bell, and also turn on the notifications for your YouTube mobile app on your mobile devices, whether it's your phone or tablet. Like this, you'll miss out on my weekly video updates. So if you're frustrated because you're not getting the results you want, and you've been doing the work and doing the exercises to help correct or help fix or help stabilize the back with L4, L5 disc bulge exercises or even L5S1 disc bulge exercises, well, I want to do some clarification in this video on why it may not be working out for you. So reason number 1 is if there is too much pain or inflammation, and the pain is a result of inflammation, some exercise may not just be appropriate to start off with. So you can't dive into core workouts, you can't dive into extension exercises, you can't start doing planks and side planks and things that will help strengthen and stabilize your back and help correct and stabilize that area for that L4, L5 disc bulge or L5S1 disc bulge if there's lots of pain that's being generated from that injured disc or even nerve pain that goes down the leg. Normally what I do with my patients is we start doing some corrective adjustments to help relieve some of that pain and inflammation in their back and also in their leg. And then the one exercise I start them off with is a mobility exercise or a pelvic tilt exercise, or in our office we use a wobbling type chair, and getting some movement, some light movement into that lower lumbar spine pelvic region. Like this, it's a bit easier to start off with the exercise instead of diving into the more intensive type exercises. Now, reason number 2 of why these exercises may not be working out for you is that you're focusing on function before structure. In my experience and what I've learned in my training as a corrective care chiropractor is that you need to work on structure before function. So any type of exercises that works on mobility, strengthening, or stretching, those are functional type of exercises. They are great exercises. I recommend them all the time. You see them all over my YouTube channel. But you'll also notice and see that I do always recommend to work on the structure before the function. What that means for you is you need to get your spine analyzed with an x-ray. You need to get your body posture analyzed, get those 2 correlated, and start working on correcting any abnormal displacements, abnormal curves, abnormal alignment of your spine before you start stacking up the functional exercises. That is super important, and it's probably the biggest mistake that I see people make. No fault of their own. They've just been misled or misguided. Many people come into my office. They've tried many other types of therapies. They've always had the functional part started first and never the structural. We get started with the structural based on their x-ray analysis and their posture analysis, start working on those abnormal alignments and displacements. Then we stack on the functional exercise later on, and they start improving and feeling better and getting back to normal life. So remember, you want to start on structural type rehab first, structural rehabilitation of the spine first, and then functional exercises. And that leads me to the 3rd reason why these exercises may not be working is that you in fact do need an actual analysis of your full spine from cervical to thoracic to lumbar, from the front and the side, with an x-ray. And that's the only way to determine what the structure of your spine looks like before you can actually even start working on the structure. And then that x-ray will determine if any abnormal alignment or any displacement of the spine or misalignment is the cause of that disc bulge. When you start to work on the misalignment component that's irritating or damaging the disc and creating that disc bulge injury, by correcting that, you're improving the mechanics and the position and the load in the spine, reducing the stresses and injuries on the disc, giving it a chance to finally heal, to finally reduce the inflammatory process and get that pain relieved. Once you have that established, then you could add those functional type exercises that you've probably been doing all along or you've seen on YouTube. So if you haven't had that done yet, an actual X-ray analysis of your spine from front to side, full spine, and you're looking for a corrective care chiropractor in your area or wondering how to find one, just comment below in the comment section below. I've helped refer many people to other chiropractic offices, chiropractors that are trained in corrective care, chiropractic biophysics. I'll just type out a directory of these chiropractors where you can look for a chiropractor that's trained in chiropractic biophysics in your actual city area. Hopefully you can find one in that area. Get that spine analyzed by X-ray, start working on the structure, and then get onto the actual exercises, the functional exercises later on. If you found this video useful, do let me know in the comments below. If you need any clarification, do ask in the comments below. And if you're brand new, remember to subscribe like this. You stay updated with my weekly videos. And I have a great video to give some more emphasis of what I'm talking about in this video. It's 6 steps that I use when it comes to getting the spine corrected for disc bulges. And you'll see exactly what I'm talking about in the 6-step protocol right here.